Doubts on that? Right, if there are no questions, we will go to the last topic. Good evening.
So the topic for today's discussion is on anesthesiologist role in the infection control, sir. So to start with an introduction, the infection control is a fundamental component of safe anesthesia practice. And the anesthesiologist plays a crucial role in preventing healthcare associated infections because of their environment in invasive procedures, airway management, vascular access, and also the perioperative care. So the role extends from the operation theater design and sterilization protocols to individual aseptic practices. So to start, the importance of this include healthcare associated infections where it accounts for significant morbidity, mortality, and also healthcare cost. The operation theater is a high risk environment due to the frequent invasive procedures, open wounds, and also patients who are immunocompromised. We being constantly involved in the airway instrumentation, IV cannulation, and use of reusable equipments, we are the key players in maintaining an asepsis here. So the sources of infection in perspective to the anesthesia includes the anesthetic equipment and circuits, which are usually reusable breathing circuits, laryngoscope blades and masks. The medication and syringes, usually contamination during multi-drug dose vial use. And also during the airway management, there can be an aerosol generation, also a cross-contamination. Also the IV lines and catheters, and hand contact and personal protective equipment lapses. So to start with the hand hygiene, there are five moments of hand hygiene described by the WHO, where before touching a patient, before aseptic procedures, and after exposure to bodily fluids, and even after touching a patient and after touching the patient's surroundings. So use of an alcohol-based hand rubs or soap and water is whenever visibly soiled. Next, the aseptic technique. So we need to use sterile gloves, gowns, masks, and caps whenever performing any invasive procedures. Also use sterile barriers using central line insertion, epidural or spinal anesthesia, and arterial line placements, and proper skin preparation with chlorhexidine or alcohol before puncture. The equipment decontamination and sterilizations include the equipments which are laryngoscope blades, which has to be autoclaved or high-level disinfection is recommended. For the face masks and circuits, either it has to be replaced or sterilized between each patients. The HME F filters, which is the breathing filters, has to be used for a single patient only. Suction catheters has to be used for a single patient only, and also reusable airway devices has to be thoroughly cleaned and disinfection has to be done. So there has to be a use of single-use items whenever possible, and also the CDC or WHO sterilization hierarchy has to be performed, which is cleaning, disinfection, and sterilization. The safe injection practices is another context where one needle, one syringe, and one patient rule. We should avoid re-entering the vials with used syringes. Also, prefer a single-dose vials. If multi-dose vials are used, dedicate them to a single patient, and also use needleless systems and closed drug transfer devices whenever possible. And also prevention of cross-contamination. The change of gloves and hand hygiene should be performed between every patient, and disinfect surfaces, including the anesthesia machine, knobs, or monitors between each cases, and use of disposable breathing circuits or filters to minimize the contamination, and avoid placing contaminated items like the laryngoscope on the anesthesia machine or any other places. Infection control in regional or neuraxial anesthesia, there has to be a strict aseptic precautions to prevent meningitis or epidural abscesses. Mask, cap, sterile gloves, and also a gown are mandatory for any neuraxial procedures. The use of single-dose local anesthetic vials for spinal and epidural blocks. In the operating theater environment, we need to participate in the OT infection control committees. Also ensure positive pressure ventilation and HEPA filtration, and also laminar flow as appropriate. and limit personal traffic and maintain clean zoning system where a sterile, semi-sterile and non-sterile system. Also, the temperature has to be maintained. The OT temperature has to be maintained around 20 to 24 degrees Celsius, and the humidity should be around 40 to 60%. Infection control during the airway management or aerosol generating procedures should include the use of PPE, N95, face shield, gown or gloves. Usually or especially in the infectious cases like COVID-19 or TB, there has to be a use of closed suction systems. Also, employ a video laryngoscope to increase the distance from the airway. And we have to follow post-procedure disinfection of the airway equipment. Regarding to the antibiotic, we need to collaborate with the surgeon and the infection control teams to ensure that the timing is correct, usually within 60 minutes of the incision. Also, correct selection of a prophylactic antibiotic, and also avoid unnecessary or a prolonged antibiotic use in these patients. Regarding the waste disposal and occupational safety, there has to be a segregation of biomedical waste into the color-coded bins, and proper disposal of sharps and puncture-proof containers. Post-exposure prophylaxis after any needle stick injury should be following the institutional protocol. Also, immunization is mandatory, like at least for the hepatitis B, influenza, or any COVID-19 diseases. And the role of institutional in infection control should be, we need to be a part of the member of the infection control committee, and we need to actively participate in surveillance audits or any training programs. And also, we need to encourage people to adhere to protocols and reporting of breaches. And we have to implement for a bundle care related infection prevention. There are some recent advances in this field too, like ultrasonography to reduce the multiple punctures, or closed drug delivery systems and pre-filled syringes. Also, single patient use airway kits checklist for any infection control compliance. Thank you, sir.
Okay. So what is the source of your question for this question?
Sir,
Where did you prepare the answer?
Sir, Miller's, sir. Miller's and CDC guidelines, sir.
So my presentation is slightly different from that.